Dr. Tehseen Ladha, Assistant Professor of Pediatrics at the University of Alberta. Thanks for joining us today.
Thanks, Marella.
So you are looking to push Alberta a little bit more to some sort of restriction or lockdown. What do you think is going to work better in the province of Alberta?
At this point, a lockdown is our only option. If there had been action previously by the government, we could have considered targeted or measured restrictions, but it's simply too late. And as you may have heard, our contact tracing system is completely overwhelmed. So we don't know where over 80% of our cases are coming from. And when this happens, we're in a situation where we simply cannot target specific measures because we don't know where these cases are coming from.
So a lockdown would be province-wide. Is that what you're looking for?
Absolutely. It needs to be province-wide. And, this is really the culmination of government inaction combined with an exponential rise in COVID cases. And we're really at the precipice of a humanitarian disaster. Our health systems are very strained. And even with a lockdown tomorrow, as was mentioned, we'll still see rising numbers, and we will almost certainly see some form of healthcare collapse for a few weeks. The longer we wait to institute a lockdown, the more severe this collapse will be, and the larger this loss of life will be as well.
Can you give me more of an expanded idea of what you mean by a healthcare collapse?
Absolutely. So we have 70 ICU beds in Alberta dedicated for COVID patients. Over 60 of those are now full. We have all of our hospitals running at 100% or over 100% capacity. From today alone, we expect to see about 60 hospitalizations, approximately 10 ICU admissions, and 15 deaths. That's based on just the cases today. We simply do not have that sort of capacity for this to be happening on a daily basis. So what will happen is once our ICU beds are full, our hospital beds are full, we certainly have some capacity for surge to overflow into, for example, post-surgical wards. However, at that point, you're getting specialists that aren't trained in intensive care or acute care looking after you. So there's shortages of specialists, of nurses, of ICU doctors. And what's going to happen is that outcomes aren't going to be good. So there aren't going to be enough staff, enough healthcare professionals to take care of not only the patients with COVID, but also patients that become severely ill of other things, such as heart attacks, motor vehicle accidents, other illnesses and injuries.
When you have put forward these ideas and this advice to the government, because you and I have spoken before, what has been the response, and has that changed?
We haven't received any response at all, Marella. There have been a number of letters sent to the provincial government on behalf of physicians and other healthcare professionals, as well as concerned citizen letters. There have also been other people speaking up in media, and there simply hasn't been a response. There's been what could be called a deafening silence. And this is what's been creating a lot of panic amongst not only our healthcare workers, but also Albertan citizens, because we really do feel as though we're in the middle of a dangerous crisis and nobody is listening.
I was going to say, if you had an open line right now to the Premier or to Dr. Deena Hinshaw, what would you say?
I have to specify that I do think Dr. Hinshaw has a great amount of expertise and does know that a lockdown is really what is needed at this point. And I think what I would say to the government is that there really is no advantage in postponing a lockdown. It's been proposed that this is an economy issue. However, rampant COVID spread does nothing good for the economy. In fact, it is more harmful to the economy than would be a formal shutdown where we could provide businesses with supports. So really what we need is for the province to save our citizens, to save their lives, and to help support healthcare workers to take care of our citizens the best that we can.
Dr. Ladha, I've got to leave the conversation there. I'm out of time. But thank you for your time today. Appreciate you joining us on the program.
Thank you, Marella.